Okay, welcome back, everyone. We're going to get started with our second session. So I will throw it back over to Dr. Martin Moreno.
All right, everyone. So for this next hour, similar to Dr. Bond, we're going to be talking a little bit about admissions, but from the perspective of our medical students. So we are having 3 medical students join us today from San Joaquin Valley Prime. Right now, we currently have Mikey and Jackie. And since Mikey's camera is on, I will pick on him first. So please, if you could introduce yourself, and from each of you, we're going to want to know where you're from, if you're local, what high school, undergrad did you go to, what medical school you're in right now, which is going to be the same for all of you, and what are your future plans, and a fun fact. And I can repeat these if you forget.
Hi, everyone. I'm Mikey Montoya. I am a 4th-year medical student at UC Davis. I'm from Visalia, California. I went to Redwood High School in Visalia, and then for undergrad, I went to UC Merced. My future plans right now are I'm applying to pediatrics, and I'll be starting my residency next year. And my fun fact is that I live with my 15-pound dog who's annoying me right now. He's a little white fluff ball. His name is Boz.
Hopefully Boz makes a guest appearance in a second, but we'll go ahead and move over to Jackie. And then once Jackie's done introducing herself, we'll start questions, but knowing that Lemuel's going to end up showing up a little bit later. So we'll pause, introduce Lemuel. So go ahead, Jackie.
Yeah, hi. So my name is Jackie Leone. I'm originally from Fresno, California, but I moved around a lot as a kid. So lived in various different towns and cities throughout Fresno and Tulare County, moved around, I think 11 times before I started college. Local. So yeah, I attended high school in Fresno. I went to Bullard High. And then I'm currently in MS3 in SJV Prime, and I go to UC Davis School of Medicine. And my future plans, those are kind of evolving. So I'm like in between psychiatry, I'm in between family medicine, I'm in between internal medicine, maybe peds. So we'll kind of see. Then a fun fact about myself, I actually tried out for American Idol many years ago when I was an undergrad. I am by no means a singer, but I went as a support person for my cousin who is the singer. So that was quite an experience.
Oh, that is so good. That's a great fun fact to have. I would have loved to see those audition videos. All right. So we will go ahead and get started with the panel. Essentially, this is going to be a Q&A panel. And as someone who has participated in panels before, it's way more helpful if the audience asks questions. So obviously, we have kind of these like staged scripted questions that are very generic in nature. But if any of these things like spur ideas off of you, it is always so helpful. And that way we can kind of gauge what exactly you want to know as participants and exactly how we can help you best. And so I think kind of hearing Dr. Bond's story about, his journey into medicine and kind of how his life was leading up into medicine. I think a very good opener question for the both of you, and you can take turns, is what were some challenges in your opinion that you faced during your journey to medical school, and what did you do to kind of help overcome those challenges?
You want me to go ahead and start, Mikey?
Please take the floor.
Okay, miss you, buddy. Yeah, so my challenges, throughout as a pre-med, I think was, being the first in my family to embark this profession. Both sides of my family, they immigrated from Mexico. So, I didn't interface traditionally with the medical care system. So I had no idea kind of like exactly what being a doctor entailed. I just kind of thought about, they take care of people when they're sick. And so that was just kind of like my just vision of what a doctor does. And then going through the pre-med classes, I went to school at UC Berkeley. I don't know if I mentioned my undergrad. But, you know, it's a pretty tough school. And, you know, being the first in your family to embark in any type of pre-health anything is just pretty challenging. So my grades were not the best in terms of a straight application to medical school. Also, too, I needed some soul searching as to why I really wanted to be a doctor. Because like I said, I never interfaced with the healthcare system. I was growing up before the Affordable Care Act. So we only, you know, got care whenever you were absolutely sick. And in my family, that meant you lost a limb or you couldn't breathe, you know? So, yeah. And anyways, it was just kind of like, okay, well, do I really want to do this? And so I actually took about a 10-year gap between undergrad to medical school. And I think for me, the challenging part was just really knowing my why medicine, you know, and I think coming into this quite older than my peers, you know, it was hard to also kind of come back into the swing of things. But I felt very supported with the SJV Prime group. Actually, Mikey is part of my class. And so I love UC Davis for that matter, but I would say that was pretty much my challenge, you know, in terms of being a pre-med student, first in your family, you know, trying to do the sciences and in undergrad, didn't get the best grades. I had to do post-bac. I had a different career. I ended up doing a master's in public health, was doing amazing community work. But then I really felt like, you know, what I was really missing was, you know, that desire, that dream that I had of becoming a doctor. So I actualized it 10 years later and I haven't looked back. So yeah, I'm happy to answer more questions about post-bacs and masters and gap years, but I'll let Mikey share his story.
So I will admit that my first choice was not medicine. It was actually to be a professional basketball player when I was like 4 or 5 years old. Didn't quite work out. I'm barely pushing 6 foot, like 160 pounds soaking wet. So this is a nice backup career. I ended up being right. Ever since I was 7 or 8, I said I wanted to be a pediatrician. So I'm glad that 7-year-old me knew what they were talking about. But my background in medicine looks similar to Jackie's in the sense that no one in my family is a doctor or anything related to the healthcare field. One half of my family comes from Spain and Mexico. The other half comes from a reservation in Minnesota. And growing up in the Central Valley, very little interaction with healthcare outside of actually just going to the doctor for, you know, regular checkups. So certain things like finding mentors that are able to allow you to shadow, which might be difficult now in the times of COVID, but were even difficult then, and going through college and applying without really knowing the application cycle are difficult things to overcome. So finding a mentor would have been something that would have been amazing, or programs that existed in the past would have been really, really helpful. But I ended up at UC Davis with the SJV Prime program, amazing people like Jackie and the rest of our cohort that, you know, allow us to have some semblance of family and community and people that we know that are close to home and that we, you know, hold dear to our hearts and make this all easier.
So we have a question from one of our participants, and I know, Jackie, you directly addressed that you are a non-traditional applicant. I'm not sure, Mikey, if this applies to you, but someone wants to know some general advice for non-traditional applications to U.S. medical schools. I believe this person may be an IMG potentially, or from an international. So if you have knowledge of international applicants, you can talk about that, but at least the non-traditional route, what are some things that you would want to offer?
Yeah, so I can, so I'm not an international student, so I can't speak to that. But I think it'd probably be fair to say that if you are non-traditional, however non-traditional is, you know, applies to you, I think the biggest thing that, so there's kind of like two things, right? There's kind of like, what do medical school admissions want to see, right? There's like that aspect of it, right? And there's also the aspect of like, why am I doing this? You know, because like, depending on what your non-traditional route was, like either that was like fine and dandy and you like redefined your life, like however way that was. So I think for me, when I was earlier on in my non-traditional route. So I was actually thinking of taking like 2 years off. And at that point, I was really focused on like, what does medical schools really want from me? You know? And then when I was more like 5, 6, 7 years out, I was more concerned about like, why do I still want to do medicine? You know, and I think that's the place that you want to be as a non-traditional student, is like real. And I think from any level, but I know that schools are going to be asking like, why did you take this route? How does this experience inform you of like still wanting to do medicine? Because the thing is that like, I started medical school at like 31, 32 years old. Like, I'm not going to be like a full actualized doctor, like training until like I'm in my like early 40s. You know what I mean? So it's kind of like, you have to like really understand, and the medical schools want you to know like what you're getting yourself into, you know? And I think if you can kind of like, yes, you have to understand kind of like what you have to do, like the science classes, the MCAT, like all of that. But I think in your heart of hearts, if you can really speak to why medicine, why now, that is really what's going to sell your application and yourself to everybody else. And at that point, you will speak from a place of like, just like so much confidence, you know, in terms of like, I have this experience and this is why you need me as a doctor. And honestly, when I was interviewing, like that's how I felt, you know? So I hope I answered your question in terms of non-traditional, but I think just own your story. At the end of the day, don't be embarrassed by it. Don't be shamed by it. Like own it, you know? And that's the asset that you're going to bring to medical school and you becoming a future physician.
Very, very well said. I appreciate all your words, because I also was a non-traditional applicant, but not exactly the same story as you. So non-traditional comes in many shapes and forms and many different walks of life. And I think you said it perfectly with own your story. So I see Lemuel is joining us, but I won't pick on him just yet. There was a question that was posted in like the public chat, and it says, is it necessary to have research to be accepted into UC Davis? And what is the lowest GPA? Before I bump this question over to my panelists, I just want to remind everybody that's listening, you know, it's very difficult to give you hard set numbers because every application is different. And it's kind of like what Dr. Bond was saying, he couldn't give you a hard set number. It's very difficult for us as residents and medical students that have gone through this journey to know exactly what everyone's GPA was, because you're not asking your classmates, what was your GPA? And so I don't know what the lowest number will be, and I highly doubt someone will be able to tell you that number, but maybe someone will be willing to share that experience with you if they felt like they had a low GPA. And I can share that myself. When I graduated from UC Davis undergraduate, my total GPA was a 2.9. That's a 2 and a 9. And then my science GPA, I think, was 2.7, which is why I ended up doing a post-baccalaureate program. Okay. So is that the lowest GPA ever accepted to medical school? I don't know, because I don't know how they weigh it with the post-bac. So I'm just going to toss it over to our applicants, and I'll rephrase the question as, did you guys do research and did you feel like your GPA needed some boosting? Were there any comments that you'd like to say about that?
So specifically for numbers, I know there's a AAMC website that I believe you can purchase access to, and it gives you specific MCAT GPA numbers as it applies to schools. But everything you guys have heard this far is true. Every application is different. Every application has its strengths and its weaknesses. And just because you might have 0 research experience and it shows that the average is 2, doesn't mean that yours gets thrown out the window right away. But I know people that got accepted with low GPAs, high GPAs, all the research in the world, no research. So it's all dependent on your application and your story that you put behind your application.
Jessica, I just want to make sure I understood the question. It was, how many years of research did we do to get accepted to a school like UC Davis?
Yeah, they wanted to know, like, how much research do you need, or do you have to do it? First of all, I think was the way it was phrased. Mm-hmm. And then what was the lowest GPA ever accepted to UC Davis? So if you would like to share, if you have any research experience or what your thoughts are on that.
Yeah, so I actually had I would say like minimal research experience. So when I was an undergrad, I worked in a lab, which you could do for work study, y'all. Like I was working at like a restaurant making like sandwiches and smoothies, work study. And then after that, I found out you can get a lab position work study. So if you guys get work study financial aid, like look that up. You get paid and it like double counts, you know, money, income, and work experience, or I mean research experience. So anyways, I was working in a research lab that was actually analyzing air quality from Fresno. And so, you know, I was going to school in the Bay Area, and like, you know, growing up in Fresno or like the Central Valley, you always hear about like poor air quality. No one in my family has asthma, you know, thank goodness. I don't have anything like that, no respiratory issues. So I never really understood like, oh, well, I'm breathing fine. And then when these air filters would come back, they would come back black. And so I was like, wow, like this stuff is real, y'all. Like our air is bad. So anyways, especially now with the like forest fires, I feel like you can see it bad. But anyways, it wasn't like that years ago. So I did that for like a year, and I was like, I don't like this. And then I like worked at a nutrition lab. They were like trying to look at like nutrition of like rats, and it was cool because I thought I'd like really like wanted to learn nutrition. You know, like a lot of my family members have diabetes, but I was just like not having it with like trying to dissect fat from like rats. And so that probably only lasted for like maybe like honestly 3 months. And it was also like a lot of data cleaning. But what I will say though is so that was like in the beginning, like an undergrad, didn't even touch a lick of research after that. But then when I went to my master's program, I really thought about research in the sense of like doing community participatory research. And so the research project that I got involved with was I did my master's in LA. And at that time, we didn't have any type of, I think, even to this day, I have to catch up on like healthcare access policies, but we didn't have healthcare to like the underserved, you know, or to undocumented. That's it. And so, you know, I'm very, 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 very motivated to take care of underserved or uninsured populations, particularly those who are undocumented. And so we were really trying to analyze my Health LA. That was kind of like the pilot program that the LA County was trying to do to like understand how do we provide healthcare access to this community with these different, you know, clinics and hospitals. And you can do a research project on that. And I was like, what? You know, so I did that. I think there was some other thing that I did. Oh, with research, you don't have to, it doesn't have to be academic either. So like I mentioned, I have quite a bit of experience in public health. And so when I was working in Tulare County, there was this paper that was written by the Tulare County Public Health Department, and it was a community needs assessment. And I got to participate and, you know, be one of the informants as an employee of a hospital in terms of like what the community needs. And because of my public health background, I was able to also help formulate the action plan. So, you know, that counts as research. So I would say probably altogether, probably honestly like a year, but you don't need a lot of it. I think the thing though is like you really want to resonate with research that really resonates with why you want to go into medicine and how you envision yourself engaging with research. I would say that's important. In terms of lowest science GPA, I would say that, you know, I don't know those numbers offhand. Mikey kind of alluded to, I think it's this, I don't know if it's called AMSAR, if that's the one.
Yeah, it's the MSAR, yeah.
Okay, so it's been a while since I applied to medical school, but yeah, look at AMSAR and it has all that information, and look at the ranges, you know, like in terms of like the highest and low. And you'll kind of see like what your school accepts. But I would encourage you that, you know, if your science GPA is pretty low, and I would probably say, you know, again, you have to look at the whole context of everything, you know, but if your science GPA is probably like a 3.2, a 3.3, you know, talk to an advisor, talk to somebody that you trust, you know, because they'll analyze your whole entire application process or your whole entire application, and they'll advise you in terms of like, hey, are you going to make up your metrics with the MCAT? Are you going to have to do a post-bac program? You know, so at that point, if you do a post-bac or if you do a master's, you want to make sure that your science GPA at that point is like at least a 3.7, like a 3.9, you know, that's your last second chance. So you want it to count for something.
Definitely. Thank you so much, both of you. So now I will pick on Lemuel because he showed up. Lemuel, if you could take a moment to unmute your mic. There is a question about IMGs and matching into residency, which I can answer after Lemuel introduces himself. So we'd like your name and where you're from. And if you're local to the Valley, please tell us which high school and undergraduate you went to, what medical school you're in right now, and then what your future plans are. And then to wrap it up, a fun fact.
Gotcha. Hello, everyone. Sorry for coming in late, but my name is Lemuel Rivera. I'm from Fresno, really. I lived there most of my life, but I was born in the Philippines. And so I went to high school and undergrad here. I went to Clovis West High School and graduated 2015. And then I went to Fresno State right afterwards with my biochemistry degree, and I graduated in 2019. And I saw something in the chat about mentioning LSAMP and I think HCOP. I was also part of the LSAM and HCOP as well in undergrad. So if there's any questions with that, I'm happy to help. But currently I'm at UCSF. I'm one of the third years, but I'm also part of the SJV Prime program. And in future plans, I guess relating to residency, I'm interested in internal medicine, specifically like cardiology. And then a fun fact, so I actually did mini med school when I was an undergrad and back so many years ago. I think it was back in 2015. When I first got into undergrad. And so I remember this, it was more in person, and I remembered how great it was, and I wanted to be a part of this. So that was my fun fact.
Thank you so much for introducing yourself. So there are some questions I have for the panelists, but I will address this question because it came up twice. About IMGs and then matching into residency, and then also how many years should medical students study before they have residency. So every medical student's going to go through a full medical school course, which is going to be, oh, there's Boz, which is going to be 4 years at minimum. Okay. Some medical students may get a dual degree where they get an MD and an MPH that could take up to 5. Some even go for an MD PhD, which can take up to 7, right? Because you do your research years and your medical school years. Those are totally separate programs, which we can talk about later, but so at minimum, it's going to take everyone 4 years to get your doctorate in medicine. After that, you can apply to residency. So when you graduate medical school, you get the MD. That's it. So in order to get the MD, you just have to graduate medical school, but that does not mean that you're licensed to practice medicine in the United States. You have to go through residency to then qualify for your board examination, and then you're officially licensed and board certified to practice in your specialty. So I had mentioned earlier that I'm a third-year resident at in emergency medicine here at UCSF Fresno. And so next year after I graduate, I will then be eligible to take my board certification test, and then I'll get my boards. I have my license, but I need the board certification to practice alone. Okay, so that's how you get from med school to residency, first of all. And then the question about IMGs, like someone asked if there's tips or tricks for an IMG to get into residency. So an IMG stands for International Medical Graduate, and these can be anyone who is from a foreign country that is coming to the United States for the first time, or anyone who graduates from one of our Caribbean schools that ends up doing some rotations here in the States. Tips and tricks. So I think the big thing, I went to a medical school that was very IMG friendly. So all of my residents that I did my rotations with were all from different countries aside from the United States. A lot of them were physicians previously in Lebanon or Iraq, and they were trying to get their medical licensure here in the United States. And then there are many from Saudi Arabia that were just transferring over or went to school in India. UCSF Fresno is an IMG friendly program as well in their internal medicine department, their pediatrics department. I think the big thing that the hardest hurdle is honestly just getting through all the USMLE tests, because those are not usually required for international medical schools. It's something that's specific for the United States. It's the United States medical licensing exam. And so studying for those on your own without any support at your school is probably very difficult. The Caribbean schools, it's a little bit different because they are geared towards getting people back into the United States to be a physician. So there is some support there. I think the big thing is when you're applying is apply broadly, but also apply smartly. So look for schools and programs that are very IMG friendly. You can tell when a program is and when a program isn't. Look at their alumni. Where did they go to school? Look at their faculty. Where did they get educated at? It makes a huge difference when you're applying. So I think those are two big things that are probably the biggest hurdles. And it purely comes down to numbers of seats. Okay. Even for the US graduates, you're more likely to match as a US graduate just because of the dynamics of the match. And the fact that every year there's going to go a certain number of people that there's just not enough space. But I think those are probably two things that that I can use to offer for advice. So now that we took that residency question out of the way, we can get back to our panelists that have more medical school knowledge. So they want to know and this is for anyone who wants to answer, and all three of you can chime in. How was your experience with the MCAT, and any advice about what worked for you with that horrible, horrible test?
I guess I'll go. I haven't talked as much. Gosh, I also hated the MCAT. I think the good thing about it though is nobody really talks about it after you take it or after you get into medical school. So it's kind of that one hurdle you gotta go through when trying to get into medical school. But in terms of what I did, so I tried to learn as much as I can in terms of like what are the resources that are available and like what are the best ones for me. I feel like it's a lot of trial and error for folks. And so for me, like I ended up settling for exam crackers. I think I tried like Princeton Review and like Kaplan, but I think what worked for me was exam crackers. And then after that, something I did was I just did a bunch of questions up until the exam. And so there's a lot of questions from like the AAMC, the official website, and those are usually the best ones because they usually relate to the actual MCAT in terms of the question style and the content. Of course, I wanted to seek more questions, so I tried to go through like exam crackers, the questions like, and then there's some free ones as well through like Princeton Review and Kaplan. And so for me, I kind of just focused on that, just try to do as much questions as I can. And then of course, with any things that I was not clear on, I would review them again and see why I got it wrong, and then maybe reread some of the content and hit the books on those questions that I got wrong.
So let me tell you all the mistakes that I made. So I took it in 2017, so grain of salt, but please, not that I didn't, but please take your undergrad seriously. It will give you the greatest baseline of knowledge to when you're actually studying for the MCAT. You won't have to cram everything that you should have learned in those 4 years or potentially can learn in those 4 years. To do as many practice questions as you can. They're difficult, they're painful. Learn from them. Don't just do them and move on. Make sure you understand the concepts of what you missed and why you missed the question, and then pick a resource along with those practice questions and stick with it. I tried to do too many things and kind of cherry picked a bunch of different resources, and it ended up working out for me in the end, but it just made my process of taking it a lot more difficult and a lot longer than it probably should have been.
Yeah, very similar. Like the MCAT is like the vein of my existence. I actually had to take the MCAT multiple times. I took the old one before it changed, probably in 2015. I think 2 times, 3 times. I only posted once, but anyways, yeah, just standardized exams. I have a history of them being pretty difficult for me. So just want to throw it out there that like even if you've taken this exam multiple times, it's honestly like, even though it feels like the end of the world, it is not the end of the world. So then as I mentioned, I took quite a bit of gap years, and so the next time that I studied for the MCAT changed, and I hadn't been studying for it for at least like 5 years. So at that point, kind of like what Mike was saying, do not learn from my mistakes. I was actually working a full-time job the last time that I did it with a new MCAT. I was working at least like 80, 90 hours. And I would just, whatever time that I could find, I would just do my MCAT studying. The month leading up to the MCAT, that's when I actually was living in Visalia at the time. My mom didn't really understand the concept of like, Mom, I really need like my space because I was living back at home. I really need you to not like bother me. And I would tell her this, and then she would come in like vacuuming the room. So my sister actually lived in Fresno. So I literally would drive Friday evening after work, you know, and spend the weekend at her house. And I was house sitting because she was doing a study abroad program in Mexico. So I did that for, I think, a good like maybe 2 months. And then I think probably a couple weeks, maybe leading up to the exam, I took time off from work. I, you know, did vacation time and, you know, did the best that I could, did not get an amazing score by no means. And, you know, still got into medical school. So I think the biggest thing is that if I could do it again, exactly how my panelists also recommended, you know, now that when you're medical school, it's all about taking exams, you know, MCAT is just the beginning. And so, you know, I would strongly recommend choosing a resource that works for you. It could be Exam Crackers, it can be Kaplan, it could be Princeton. What's great about, I think it's Kaplan, I'm not sure about like Princeton, but like they have their own questions. And then also too, they give you access to double AMC ones, you know, so you don't have to double pay. But I would say definitely do practice problems and also learn from your mistakes, like Mikey was saying, and take practice tests. That's the biggest thing. You have to know, take a baseline practice test before you start studying, you know, do your questions. People are doing Anki too. Like, it's like everybody now studying for like medical, or everybody studying for MCAT is like studying for like medical school exams. It's like vicious. It's like, you guys are all like hardcore. I love it. But like, I found that those strategies, which I didn't discover until medical school, actually really help. So again, practice problems. You need some type of tool, the spaced repetition, gauge your performance, make sure you take care of yourself, and you know the MCAT should be okay. Talk to people who like, you know, also have gone through that similar experience too.
Thanks, all of you. I have a question that's probably more specific to Jackie, unless anyone else has other advice. Any advice for high schoolers who want to enter the medical field, especially students that are undocumented or DACA recipients?
Yeah, I actually have some really good ideas. And this is actually what I tell even my college students, my, you know, those who've already graduated students, you know, like about health care, think about health and wellness. So, you know, like a lot of times, all of us, like the hospital, the clinic, the school, the food pantries, like we all serve the same population. So what I would do is, if it's hard to get connected to like a hospital or to a clinic, because even if you're documented, it's hard to get experience, you know? So what I would do is I would be really interested in like, know who is the patient population or the community that you want to serve. So for example, if it's like women, like I'm all about women's health. Like I want to make sure that they know, like, you know, their own bodies. I want them to know, like, you know, what type of birth controls. I want them to know, like, you know, just all those different things. You can work at a women's shelter, and like sometimes like women's shelters, even though like it's not a traditional like hospital or clinic, they actually have mobile vans that come and like provide free healthcare to this community. Same thing with like, let's say, I know in Fresno, we have the Poverello House. You know, they provide, you know, meals, and I don't know if it's housing, but like, they provide a resource. At the end of the day, if someone that's, experiencing homelessness comes to the hospital, we're serving the same patient, but just from a different angle. So what I would encourage you is that like, think about health and wellness holistically, and think about what are ways in which like that place can deliver health. So a last example, school-based health centers. Some schools provide healthcare services at the school, and so you can see like, maybe you can like come up to the doctor there, and I'm sure they would love to like shadow you or have you shadow them. Sorry. Yeah. And so, that's what I would do. Get creative, and you'll be quite pleased to see that like people actually are really receptive to that.
And then to open up to our other panelists, what kind of along the same vein, what is a piece of advice you would give to a high school senior who's interested in the medical field? I don't even remember what that was like when you're barely starting before college. So what would you say to your smaller high school self, I guess?
On a lighter note, if you were in high school asking that question and you're here, you're off to a great start and a better start than I was. The thing that I can tell you specifically is that at the end of this, I can leave my email for you guys, and anyone that has any specific questions, no matter how dumb it may be, there's no dumb questions. Trust me, I've been through medical school. Leave them, I'll help. The greatest thing to have is a mentor that has been through it. And that's something that I really wish that I would have had going through at least college and high school. So if you guys have any questions, I'll leave my email down in the chat, and you guys can email me with anything you need.
Yeah, and kind of going on what Mikey has mentioned, I think one of the things I remember, because I really wanted to go to medical school, but I had no idea like how to get there. And I realized that, and I was stuck. And so actually the summer before undergrad started, I kind of searched around Fresno State, and I asked them from people like, hey, who's the pre-med advisor around here? Like, how do I get to know med school? Because I know nothing. Like I was an immigrant from the Philippines, and so my parents, I had no idea what college was like to begin with, and then like obviously I have no idea what med school, like how to get to med school. So that summer before undergrad started, I like searched people, like I asked people like, hey, who's the pre-med advisor here? And I stumbled along HCOP, and I think maybe some of the participants may know what it is. It's called the Health Careers Opportunities Program, and it's a program in Fresno State, and they help students, help pre-med students try to get into medical school, whether through like exposing them through like shadowing opportunities, conferences, like visiting other med schools, and so I would say I think the first step is to find a mentor, and then afterwards kind of just take it step by step. I really don't know what the second step was. I don't remember that one, but I remember my first step was I needed to find somebody who knew how to get me there. And so that's what I did.
Great advice. I always recommend getting a mentor. So someone mentioned that Jackie told us a little bit about why she went into medicine and what was her why. They want to know about Lemuel and Mikey. What's your guys's why? For why did you pick medicine? What was it?
So specifically, I want to do pediatrics, and I'll save you guys the hour spiel that I have, but children are objectively better than adults. They brighten your day. They make you laugh. Adults cry. Don't let anyone tell you that they don't, except kids are cuter when they cry. So being able to help, kids every day and keeping that innocence in you that you had when you were a kid, and being able to laugh and give stickers, it's the best job in the world. I couldn't see myself doing anything else. And as hard as it gets, as many hours as it is of studying and being in clinic or the hospital, I'm happy at the end of the day. Like I come home whistling and I smile. So that's my why.
I also agree, although I'm not interested in peds, but kids are fun. They're fun. I like the peds clinic. But yeah, I think for me, it started when I was pretty young. My mom had cancer when I was around elementary. I think it was elementary school, so long ago, I barely remember. But she's okay now. She's been cured, and I think a big part of that was the oncologist that she had. He was a good doctor. He took care of her well, and he was kind of a role model for me ever since. And so that's why in college I wanted to go to med school, and that's why I mentioned earlier, like I need to find somebody to get me there. And afterwards, while in college, I learned more about Fresno. I mean, I wasn't born in Fresno. I came here back in 2009. So I knew a little bit about it, but I didn't understand the health disparities actually until I got to college, until I was also a scribe in the ER department actually at CRMC too. So I learned a little bit more about like, what they go through. Again, HCOP exposed me a little bit more about Fresno and some of the issues that we have here. And for some, and I just wanted to help. This is like the home that I want to be part of. You know, I moved around a lot, and I feel like it's hard to say what home is for me, but Fresno kind of became that the more I lived here. And so I wanted to help my community, and I wanted to kind of be part of the solution. There's a lot of problems that we have here, especially because it's due to like physician shortages. And so for me, that was like another reason why I wanted to do medicine and specifically come back to the Valley, because it's my home and I care about the people here, and I just want to help.
Wonderful answers from both of you. I think this will be a quicker question, and then we'll get into a deeper question. I think everyone's a little confused, and I understand why. And I want to see if anyone else wants to answer it. They want to know, is the SJV program at UCSF or UC Davis? Which school they need to apply to? What's going on? And I understand the background, but does anyone want to address that?
I guess maybe I'll say it. So now SJV program is at UCSF. And I don't know the exact political reason or like why it switched over, but I'm part of the first cohort of SJV primers from UCSF. I think Mikey and Jack are part of the last cohort from UC Davis. But there is another like similar prime program at UC Davis. It's called the REACH program. It's very similar in missions and what they do. I think they just work in a different hospital. But yeah, so now it's at UCSF. I actually wanted to go to UC Davis because SJV was there and I wanted to do SJV. But it ended up being at UCSF, and I was like, dang, I gotta go to UCSF now. So
that would have been the better choice, Limo, but that's okay. I will give the UC Davis spiel. We have a program called REACH now, which is similar to SJV Prime in the sense that it is people from the Central Valley that want to stay in the Central Valley, except instead of doing their third and fourth year potentially at UCSF Fresno, CRNC downtown, they do their third and fourth years kind of scattered throughout Modesto and Stockton.
Yeah, and I would also just add, you know, actually, I'm kind of jealous of you guys applying to medical school, because when we applied, there was just one program specific to Central Valley training, and that was UC Davis. And so now you all can apply to 3 different programs. You can do UCSF SJV, UC Davis REACH, and I know there's a new medical school that just opened up not too long ago, the CHSU. So, you know, a lot of people know that there's a huge need, and that's why there's all these programs to, you know, grow their own, to keep their own, you know, and those who are also very committed that, you know, they'll train you. So just want to leave you with that you have 3 programs as opposed to us, you know, like we had 1 and then 2, you know, so.
That's a great point. I know I desperately wanted to go to UC Davis for SJV Prime, and very quickly in the primaries, I didn't get in, and I was like, my life is over, and it ended up working out. So now this is probably a longer winded question. So someone addressed this to Jackie. So Jackie, you shared that you have experience in public health. Could you elaborate more on how your work in public community health has contributed to your journey in medicine? In what ways, this is such an interview question, in what ways did it refine and shape your career now? Thank you.
Yeah, I think this is a beautiful question, you know. So for me, what motivated me to actually pursue public health was everything that I experienced and that I didn't experience. So what I mean by that is the health disparities that I witnessed, and growing up in a little rural town in Terabella where like the population is like 3,000, every other household is like a relative of mine. There's not even like a middle school, high school there, like, so that was my very humble beginnings. And then from there, I saw the different way of life that primarily undocumented community that are all Latinx, farm workers to like a very big city like Fresno. And so, just seeing firsthand just how a different community, and I lived in Northwest Fresno. And so there was a lot of resources, a lot of affluence that I saw. And so when I actually went to undergrad, like I said, I kind of had this like idea of what doctors did. I was actually, and this surprises a lot of my friends to this day, I didn't pursue a science major. I chose public health because I really wanted to understand the big, like important factors in my mind that influence health. So I strongly believe the spaces in which you work, sleep, eat, and pray, that's what influences health. And so I wanted to understand, how does you living in this zip code influence your health? How does you being a Latina help influence your health? How does having a job that doesn't even give you benefits and health insurance, influence your health? And so for me, that's what I gravitated towards in public health. And so when I did my work, I worked in a FQHC. It's a federally qualified health center. Basically, you're serving those who are underinsured, meaning they have health insurance, but to be able to like pay for medications, to be able to access like specialists, like it's just so hard. So, I worked at a clinic that like primarily served that community, also undocumented. So I was leading up like health education programs because in public health, we're also very big on like preventative health. So I was really, I was in charge of training the health educators to go to like high schools. I was also working with like the school board. I was working with these different nonprofit organizations on like, how do we address this issue of, let's say, a women's health? How do we address this issue when it comes to like dental? And so I loved it. And then from there, I ended up going back. I did the postbac program, master's in public health. And then I ended up working back in a hospital in Porterville, where a lot of my family lives, and I was directing population health management. So it's kind of like, okay, how can this hospital now, be able to implement preventative programs, but also too, they didn't have palliative care. They didn't have like weight loss programs. Like they didn't have any of that. So I was in charge of doing all these new service lines in this hospital that was primarily serving like my family. And so for me, how that informed me was that, okay, I want to primarily be a primary care physician. Also too, I see myself being engaged in policy work moving forward. I see myself being engaged in being, creating and evaluating community informed programs. And that's how I see my role as a physician, like in the patient room, in the hospital, but most importantly, outside of the hospital.
Thank you so much, Jackie, for kind of going into that. I think something that's really important now that I'm kind of further in my career is if you completely ignore public health, that's completely negligent. There's so much of your career that involves public health. You depend on so many public health workers, public service workers. There's no way that you could do your job without. That was beautiful. Thank you. So people in the chat giving you some snaps. So I don't have any immediate questions that are burning. We do have I want to respect everyone's time. We have about 8 minutes. Someone asked about the cost of medical school. There's always the question about the cost. I'm happy to address it because it's kind of a question. Medical school is expensive. As someone who is a California native that went out of state for medical school, it was like double what I was going to be paying that if I had gotten into a UC school. I financed my medical education entirely on loans because my parents are not rich and they are not doctors, but it is possible in some situations if you are lucky. And essentially I will be paying those back, but everyone in my program is paying them back, including the attendings. We have conversations about this all the time. So my bosses are talking about student loan payments. And I just want to say it's possible. The numbers are incredibly frightening. We can have a long conversation about student debt and the student debt crisis, and we can get into it if we want to, but we only have like 8 minutes. But let me just tell you this. Everyone always told me you don't see homeless doctors, and that's true. It hurts to pay back that kind of money, and I'm not trying to minimize the burden that some people have to shoulder more so than others, but you can survive, you will survive. And maybe you will be the policy changers that come in and kind of cap this tuition burden. So does anyone have any open questions that want to raise their hand, turn on their cameras? Do we have any last minute conversation pieces from our panelists? I'm also happy to answer any questions about like post medical school residency questions if anyone wants to know, but I feel like that's a little further out from where you guys are at. And if our panelists want to put down, their emails, Lemuel, if you want to put your email down, that'd be great.
And we'll take words of advice too. I mean, you've been giving them obviously all along, but I'm inspired by all of you. So please share anything else you'd like to with us.
Get a dog. It's nice to come home. It's a lifesaver.
Yes, I have my dog and she's always happy to see me. No matter how mad everyone else is to see me, she's always happy to see me. Any other what was the program you guys talked about when volunteering in COVID? I think you mean the COVID Equity Project, which I don't know if maybe any of you three have any words about COVID Equity Project. I don't know if any of you participated in it while you were here.
I think that would be more of a Dr. Bond question specifically. We did participate in it while we were here, the initial rollout of the COVID vaccine and kind of helping administer that. But that is Dr. Bond's baby. So that would be very much a Dr. Bond question.
Yeah, so you can sign up by following that website. Summer just put in the link. Click that. There's a link to fill out your volunteer form. I also help out on the COVID Equity Project from the medical side of it, meaning the Dr. Bond level. He's kind of showing me the ropes of what it's like to kind of run things. But I have gotten on the ground level. And when we were in peak season, just a couple weeks ago, when we were at our second surge here, we tested 546 people in one day. We were moving and we were hustling, and it was definitely 105 degrees that day. So it was everyone was really sweaty and really cranky, but we did it. So if you're willing to help out, definitely help out. Luckily, our numbers are coming down. Well, I think it was, if you were to go back in time, would you still study medicine?
Yes, every single day. There's inevitably potentially some of my classmates love everything. They go through OB-GYN, they go through surgery, they go through internal medicine, and they love every part of everything. It's okay not to love every part of medicine, but if you find what you love, like for me in pediatrics, every day of the week times 1,000. Yes.
Yeah, I would. And, also too, I'm just gonna be real with you all. I don't say yes every moment of medical school to that question. There are moments where I'm like, what the heck am I doing? Why did I do this? Why did I want to be a doctor in the first place? But that's why it's so important to know your why, because medical school is rough. It is hard. So, at the end of the day, yes, I'm so extremely honored to be able to do this, but yeah, just be compassionate to yourself that sometimes that answer won't be yes, and go back to your like why you like still want to do it, and then you'll like be like, oh yeah, this is why I'm still studying in the wee hours of the night, you know.
And then if you're still sad, you can find Jackie in the library and she'll give you a hug. It'll make it better.
Before you guys sign off, there was one more question that kind of goes back into this, what you guys were talking about. How were you guys able to take care of your mental health while in medical school? We have 3 minutes. I think this is a really crucial question to answer, because Jackie, you're totally right. There's a lot of moments of soul searching. Even in residency, you got to soul search sometimes. So what did you guys do, and what was your guys' advice for that?
So I was half joking when I said get a dog, but getting a dog honestly really helped me. And then again, I was half joking when I said go find Jackie to get a hug in the library, because having someone to come home to and having friends that'll help you get through what you're going through, that know what you're going through. The SJV Prime program specifically, we have a cohort of 6, now 9 of us that are my family. And we're here in Fresno, we're here together, we know what we're going through, and we can count on one another. So obviously, you know, things that everyone are going to tell you, like setting aside time for yourself, things you like to do, but to have people that you rely on, whether that be family or classmates, that's what's going to get you through this at the end of the day.
And definitely agree with what Mikey said as well. Like I think like I learned a lot actually in medical school in terms of taking care of myself better. Just because it's so hard and there's just so much to learn. And I mean, the challenge just grows and grows as kind of progress. But for me, I think it just goes back to just finding time to do things that I enjoy and like spending time with family and friends. I think that for me, that would really help me.
Yeah, a lot of times your family's not going to get it if they're like not in medicine, but they're always willing to like, oh, that's okay. You know, that's how my family is. They don't understand anything I'm saying, but they're like, well, we believe in you. And that's all I need to hear. So, all right. I want to respect everyone's time. We have a minute to go. Thank you so much. Please, a round of applause for our panelists. They were amazing, amazing, inspiring people. I'm so excited for the future of medicine. I'm so sad none of you said EM, but I guess I'll let you all go. That's okay. And if anyone has any like nice words of affection to give them, please put it in the chat. Thank you guys so much.
Yes, thank you so much for taking the time. We know you're so very busy. So thank you so much for coming and speaking to maybe the next generation of Prime students or Reach students, because hey, you know what? I'm so thrilled to hear that Limwell went to Mini-Med. I could just cry right now. I'm so thrilled to see it come to fruition, because this is kind of why we do it. We do it, you know, partially for education in the community, of course, but it's really inspiring to see someone go learn something and come back to us. We're really, really excited about that. So thank you, everyone. I'm going to go ahead and one more time, if you want that certificate, I'm going to put it in the chat. You guys can go ahead and fill that out when you get a chance. Don't feel like you have to rush and do it tonight. I will check it over the next couple of days and I will get it back to you in the next couple of weeks. So thank you again, everyone. Thank you so much, Dr. Martin Moreno. You are amazing for stepping in for Dr. Dillon. We truly appreciate it. And thank you so much, everyone. We will see you hopefully next year. And a little teaser, we're trying to get a Mini-Med boot camp going. So probably be reaching out to some of these panelists. Who knows? We're gonna need a lot of volunteers for this thing. Hopefully it's in person, but more to come on that. So thank you everyone for coming to Mini-Med, the 10th anniversary, and we'll see you next time. Thank you so much. Have a great evening.
Thanks, guys. Have a good night. Study hard. See you all.